Unmask the truth, own your health. Welcome to Unmask Health. Welcome back, everyone, to another episode of Unmask Health. I am, again, your host, Shelly. This week, we're going to kind of touch on a subject that I am sure stays on the mind of most men, if not all. And I've had several men reach out to me or email me with a couple of questions regarding this topic. And so last week I had said that I was going to talk, we talked about prostate health last week and ways to keep the prostate healthy. And so this week we're going to talk about masturbation and healthy ejaculation. And this may not be something that you want young ears to hear, and that's fine. It's not derogatory in any way. But so we're just going to talk about what masturbation, why people focus on masturbation, why men focus on this, the benefits and the risk of it, and what is normal masturbation. So let's just start off with the truth about masturbation. It's healthy. It can be healthy. It does help keep your prostate healthy. Not only does it do physical health, but it also is good emotionally for your mental health because it releases the dopamine, the feel-good hormones in the brain. And so it helps with not only that, but it also helps with the hormones, male hormones, which is your testosterone. And it also helps keep your pelvic floor muscles healthy. At the end of this, I do have a pelvic floor exercise routine. I have discussed this with a patient recently. And if you're interested in wanting it, I do have that PDF and I can just email it to you. You can email me and I'll be glad to send it to you. Or you can Google, your own pelvic floor exercises for males. But everybody should be doing that, not just men. Women should be doing that to keep our pelvic floor healthy also. But also it has a light cardiac effect when you're masturbating, and after you're done masturbating, it increases the blood flow for your erections and stuff. So, and then again, it does help with keeping the fluid going through the prostate, and so it keeps the prostate healthy. That's just kind of the mundane, boring topic of masturbation. And so overall, yes, masturbation does help with the physical and mental aspect of the body, and it also helps improve your sexual performance if it's done healthy. And I know probably it popped in your head like, how can masturbation be unhealthy? Well, it can, and we're going to kind of talk about it a little bit. And I'm sorry, my allergies are just messed up, and so I sound like I have a frog in my throat. At any rate, there are some myths related to masturbation. It does not make hair grow in the palm of the hand. I have talked to a male friend who was told that one time when he was growing up. His mother told him that to keep him from masturbating, when he was a teenager. And, if you're having short periods of abstinence and then you're, masturbating or sexual intercourse, it will kind of peak your testosterone level a little bit. And, it's just healthy overall if you do healthy masturbation. The best frequency for it, what research says is, I've had a patient ask me, is it safe to do every day? Is it beneficial to do every day? And so I kind of delved off into the research to find out because, I'm a woman. I don't know about the men's side of it. So I kind of researched a little bit on the men's part of it. And what I have gathered is, 2 to 7 ejaculations a week for men is, your best bet. Your best frequency, what they kind of notice the most beneficial results will be is from 2 to 7 ejaculations a week. And so if you're comfortable with that and you're, open and whatever, and even if you're not open with it, if that's something that you privately do behind closed doors, unless you're in a relationship, and I'll talk a little bit more about that. If you start having trouble though, you notice that you're masturbating more frequently, or you've just started masturbating more frequently, and you notice that your either erections are kind of decreasing or your ejaculations are kind of decreasing, well, then you need to back down on the frequency every week. So let's say you're doing it one day a week and you start noticing, hey, it doesn't feel as right like it used to. The amount of ejaculate is not what it used to be, or your erections are just not as firm or, to your benefit what that used to be, then I would say back down on the frequency. It's going to be, based on each male. It's not, I can't just put you all in the same cookie cutter because it's not going to work the same for everybody. So generally we will say 2 to 7 is what works best for males. Again, we talked about prostate health last week, and how keeping that fluid moving around in the prostate kind of keeps it healthy. And so, if you have, there's varying research on decreasing the risk of prostate cancer, on the frequency, based on the frequency of ejaculations that you have. There's some places that say, you know, 5 times a month is good. But there are some places that say as high as 21 times a month will lower the prostate cancer risk. Now, that's not the only thing that's going to lower your risk for prostate cancer. This is not, masturbating, ejaculation is not the only thing that decreases your risk for prostate cancer. I just want to make that well noted. There are other risks of prostate cancer. But anyway, it also, again, it keeps that fluid moving around the prostate, and it could reduce pain and infections around that prostate. That is a risk that men face, is prostatitis, and it's painful, and you have to go to the doctor and get antibiotics, and, that's disruptive to your life, and, all the things. But just like you need movement, like exercise, I promote exercise, whatever. Your prostate needs that. Just like your pelvic floor needs movement to maintain its health, your prostate does too. Does masturbation help with mental health? That was a question that I received over the past week. And I would say yes, generally. Now, if people are having, men, I'm just going to speak on men's part. I feel like masturbation reduces stress and anxiety in a man. I feel like if you're having sleep disruptions or trouble sleeping, that sexual release will help kind of alleviate some of those problems for you, as long as it's not excessive. It's also healthy for, like, if you're in between relationship gap, you're having a gap in your relationship, or, something's going on. Maybe your significant other just had a baby or whatever, and you're frustrated. And listen, there is a lot of shame that is focused around masturbation. I did have somebody talk to me about that. And it's not that he doesn't masturbate, but it's almost like a guilty subconscious thought that's there for whatever reason, because he, is really devoted to his wife, or, religious reasons. He did ask me about how I felt about religion. And yes, there are some components, there are religions out there that, denounce masturbation at all, that you're not supposed to, do that, whatever. I'm not here to preach on religion or preach whatever. You have to do, what's best for you and what your beliefs are and whatever. And if it's something that you are taught not to do, then you do not need to listen to me at all. I'm not here to sway you one way or another. I'm just here to overall talk about to the men who want to know more about healthy masturbation, who already masturbate. But at any rate, so there are relationship benefits to masturbation, as long as you are open and honest with your partner about it. I don't think it's something that you should be keeping in the closet away from your significant other, because then it becomes, I'm a female, and if I was worried that I'm not, you're not having sexual intercourse or as often with your significant other, then I find out that you're masturbating in the shower or wherever, and I'm like, okay, women are going to automatically think, well, if you can do that with yourself, how come you aren't doing it with me? Well, what's wrong with me? I mean, we're not crazy. We're emotional, but we're not crazy. And so I think it's always good to have open, honest communication with your significant other. And you can explain it to her, to whoever, the reason why you do it. There are healthy benefits to it. You can share some of those with your significant other. But if something's going on with your partner, they've had surgery, again, they've just had a baby, they're stressed out, they're not in the mood, maybe she's going through menopause, what have you. It does reduce that stress on your partner, but just be open minded and be, if you're on the receiving end of that conversation, just be open minded. That's number one. But always be open with your partner and always talk to them about what you're doing and what the expectations are and whatever. I think that, keeping things hidden will just lead to more complications. The next thing is the big thing that this is what what every man wants to know. I've had a couple of questions about it, a couple of emails requesting more information about it. Can masturbation be harmful? Absolutely. It can be physically, mentally, socially, the whole nine yards. And so, what are some of the red flags of harmful masturbation? Well, number one, are you hurting your penis? If you're excessively masturbating and you're causing friction, are you causing what we call excoriation, like skin irritation, bruising, soreness, whatever of the penis, that's harmful, and you need to stop that. Like, figure something else out that's going to work for you. I always I did have a male a while back ask me about it. And if you're facing friction issues or whatever, you need to use lubrication or water. Water's a natural lubricant. There's no reason for you to be causing those kind of harms. But at any rate, are you secluding yourself from friends and family? Like, or are you thinking so much about masturbation? Is it like an all-day thought for you? Are you having a hard time completing tasks at work, completing tasks at home, carrying on a conversation with people, watching a movie, finishing a movie because your thoughts are constantly surrounded by masturbation? Well, that's a fixation, that's an obsession, and that's a problem. The other thing is, is the masturbation causing you to stop having sex with your significant other? A lot of the times, and I've heard this in the past, a lot of the times the reason why people would prefer to masturbate than to have sex with their partner is because it's less stressful. For whatever reason, is something going on with your significant other? Is she going through menopause? And you're supposed to say, no, that's not why. That's not why. Anyway, no, I'm just kidding. But, some people find it less troublesome to just masturbate and not worry about having to initiate sex with their partner. And that's a problem. Again, open communication is very important for a lasting, strong, healthy relationship. If you, and I'm probably going to step onto some toes, and that's okay. Maybe it will be helpful for somebody, and I hope it is. But if you are having to watch porn to climax, that's an issue. That should be a red flag to you that you should immediately be like knocking you in the forehead going, okay, something's wrong. If you're one of these individuals that has never been involved with watching porn and then all of a sudden that's all you want to do is watch porn, like you get up out of the bed in the middle of the night to go wherever in your home to watch porn, to masturbate, that is a humongous red flag for anybody. I don't care if you're male or female. That's a red flag. And there are other problems that could be going on there. There could be some underlying mental health issues, like maybe there's bipolar disorder going on. And I don't want to delve too much off into it because I'm going to try to keep this, just focused around masturbation. And we can focus on, I can discuss that at a later time if necessary. But if you're over masturbating, it can actually lead to erectile dysfunction. There is a position that men, I don't know, for whatever reason, and maybe you can tell me what it is. I know the scientific reason for it, but I don't know how it ever gets started. Prone masturbation is a definite no-no. Don't ever get it started. Don't ever start doing it. If you're doing it, you need to stop immediately. And from what I've researched, it's because the pressure, you're able to put more pressure on the hips, and so you have more firmness, I guess, in a prone position when you're masturbating. And that will lead to erectile dysfunction. It will lead to problems with ejaculation. It's not a matter of if it will happen, it is a matter of when it will happen. So heed my advice. Oh, if you don't listen to anything else today, listen to the fact that you do not need to do prone masturbation ever. The other thing is, are you avoiding intimacy with your significant other? Are you avoiding social events? Are you missing work? Are you, anything that is outside of your normal activity? Are you doing it because you are so focused on masturbation? And that is a red flag. I say all that to say that you should absolutely, if you are experiencing any of that, I don't want you to feel ashamed. I don't want you to feel like, that you should be embarrassed about it. If you don't have the knowledge of what healthy masturbation is, that is not something to be embarrassed about. After today, you will kind of have the key components of what healthy masturbation should be, and it should raise red flags to you outside of anything that would be normal. Or you're diverting back to whatever. You got rid of porn one time in your life, and now that's all you seem to focus on is porn. Anything that is diverting away from your normal routine life or your normal habits should be a red flag. Again, prone masturbation is what? It is absolutely a no. Don't do it. Don't start it. If you're doing it, stop it. Please, just don't do it. If any of these things are happening, and you are one of the men that's like, okay, well, what she just said is exactly what I'm doing, or you're focusing too much on masturbation or, even sex itself. And I'm not talking about just the thought passing your brain 3 or 4 times a day. I'm not talking about that. I'm talking about where it's disrupting your life. That is a red flag that you need to go and see a sex therapist, a psychologist, a psychiatrist. Start with your healthcare provider if you have to. Are we treating underlying things? Like, are you wanting to do it so much because it does relieve so much stress in your life, or it does make you feel good, but you immediately go back into you're depressed, you're sad, you're angry, whatever. There could be some underlying components there that you're trying to self-medicate with masturbation, and that, like, are you depressed? Are you having anxiety? Are you, why aren't you sleeping well? Do you have sleep apnea? Those sorts of things. And so I always recommend that you go and sit down and talk to your healthcare provider. If you don't want to do that, if you're too embarrassed to do that, email me. I'll direct you somehow. I can't treat you over the phone or the computer or through the email, but I will hopefully give you the tools that you can go and get the appropriate treatment that you need. But there are sex therapists out there that are available. You are not the only one ever. Please don't think that you would be the only man to ever have to go to sex therapy. That's not true. Women go to sex therapy. It's not just a male issue. But I do want you to know that if you're having the red flags and you're having the disruptive masturbation, problem, that you probably need to see a sex therapist. At the least, see your healthcare provider and talk to them and be very open. We're not there to judge. I promise you, if you thought your story's bad, we've heard it 10 times worse. And even so, even if we haven't, we're not there to judge you. I'm as a medical provider, I'm not going to judge you for what you do with your lifestyle, whatever. Am I going to try to give you corrective behavior and try to find the underlying cause? Absolutely. Will it be uncomfortable? Probably. Yeah, probably, until you get to know your healthcare provider or you trust them. But it is to your benefit and those around you that you do go and you get the appropriate help. So, at any rate, again, I'm going to kind of highlight all over again. Masturbation can be healthy. I'm not telling you that if it's against your religious belief or your own beliefs of whatever, that you should start doing it based on what I tell you today. Um, I know I have talked about, yes, masturbation, ejaculation, healthy ejaculation is good for the prostate. It's good for mental. It's good for, the release of the good hormones. Yes, it does help with the testosterone, all the things, but there are other things to help with that besides just masturbation. That's not what the focus of this is. Again, healthy ejaculations average, the frequency of that is about 2 to 7 a week. Again, if you start noticing changes in your normal, your baseline from your baseline pattern, then you need to either go down on the frequency or stop altogether. There are healthy tools for masturbation. You should never, don't cause injury to yourself. Use lubrication. Be open and speak openly with your significant other that, yes, this is what I'm doing. How do you feel about that? If they have a problem with it, then, y'all can talk more about it, be more open about it. Maybe you can educate your significant other. And that's what, you want to do. You want to have that open communication and both of you kind of come to an agreement or whatever. The red flags, again, is that you're focused way too much on it. And I'm not talking about just like passing thoughts here and there. I'm talking about so fixated on it that you can't even get up and go to the grocery store. Or you want to call in from work because you would rather stay home by yourself and just focus on that all day long. Again, don't ever start prone masturbation. I'm going to kind of end it with that one. Don't ever start prone masturbation. It's not good. But just know that there is a stigma behind masturbation, and I get it. But there are ways to be healthy with it. There are ways, of course, to be unhealthy with it. I hope that some of the pointers that I hit today were, helpful, beneficial. I hope that you reach out to me with more questions, or suggestions on what you would like to hear as a man. Just know that I'm non-judgmental. I don't judge. I'm not here to judge anybody on what they do. Please don't email me with any of your off the wall stuff. Like, I don't want to know anything about, anyway, animals, nothing like that sort. Okay. Have I received anything like that? Have I ever faced any of that in my career? Yes. But that had already been handled, legality reasons. But anyway, I kind of teetered off the path there. Just know that males, there are healthy ways to masturbate, and if you have a question about anything, please reach out. The email is listed below. Next week, I'm going to delve more off into sexual health of men. I think that there's so many misconceptions out there, and there's some harmful misconceptions out there when it comes to sexual health in men and women, but males for sure. And if you have any questions that come up, concerns, I'll be glad to listen to you. Please subscribe, follow, share, because I enjoy being able to help as many people as I can, even if it's just 2 people, 1 person, 5 people, 50, whatever. I want to be able to help at least 1 person and make you more comfortable with your body. If you want to email me any more show suggestions outside of just sexual health, anything else that men want to focus on, because that's not the only thing that men are. Yes, you are the sexual people, but that's not the only thing that you are. So I'd be glad to listen to any suggestions that you have. I hope you have a great week, and go unmask, be bold, stay healthy. Until next time, bye.